Oh, okay. Still practicing, but you won't give me your name? But you're my colleague in plastic surgery, and you won't give me your name. Yeah, I don't understand how it's connected. I understand that the CEO was murdered, right? But I'm your peer, and I want to have a conversation with a peer about a patient who has breast cancer and lymphedema, and I would like to know your name. How do I know who you?
That's
Yeah.
crazy. Like, don't even give their name.
That's, they pay these people and like it's all about the money. They're paying these people so that like they can essentially be traitors to their profession and work for these insurance companies. Like oh God, it's the entire system is made so that they don't pay for care. That's like the exact thing. Like it is specifically created for this. And like these doctors that are working for the insurance companies are traitors. They're traitors to their profession and they don't care about patients. They only care about the money that they're making from their their getting paid by these insurance companies. Like follow the money. Somebody that's being paid by an insurance company has a vested interest in denying care and making money for that insurance company because that's how it works. Like even the dentists that work for like Delta Dental, they're the same way. So like even if you get a doctor on the phone, they are they are meant to make it so that you can't get your care done because they are essentially bribed to deny care.
So there was a position that actually has gone viral for her phone call. And this is a phone call that she had that I think it shows how bad the private health insurance industry really is. And it's really just a money making scheme in order to take as much money out of our pockets while denying us care. And, let me ask you first, Lex, as far as your opinion goes, what was your reaction in December of last year when you found out about the alleged shooter, Luigi Mangione, gunning down Brian Thompson?
I mean, I understand that terrorism isn't a way of getting effectual change, but it is a way of showing that the people are fed up, that patients are fed up, that physicians are fed up, that everybody that's actually involved in this, that's not just taking money out of people's hands in the insurance companies, is fed up with this system that's not working and that is specifically made to deny care. And the way that people rallied around him was honestly incredible. I mean, it truly it opened my eyes a lot to the fact that I wasn't the only one that was seeing these issues, that it wasn't just like the patients that I was interacting with day to day, that it was everybody. All of us can see it. And, somebody finally did something. Um, and it really, I don't know, it brought to life a movement that kind of died after Bernie lost for like universal healthcare and such. And I mean, I was just like really shocked that somebody actually did something finally and that it brought people all over together.
Yeah, it's crazy because when people like Ben Shapiro were rebuking people for really having kind of a Schadenfreude type of response to Brian Thompson being gunned down. They he basically tried to give a rebuke to people, and many people in his comments were clapping back at him, saying, "You're absolutely wrong. We all feel the exact same way in regards to this healthcare system." So I want to share this really quick because I want to share where it starts and then I want to go to where it continues. So this is Dr. Elizabeth Potter, a surgeon. So I want to get to this viral video that happened here first, and then we will get into the follow up with the phone call. So let's get into this first.
It's 2025 and insurance just keeps getting worse. I just did 2 bilateral deeps and 2 bilateral tissue expanders for patients. And I've never had this happen before, but during the second deep, I got a phone call into the operating room saying that United Healthcare wanted me to call them about one of the patients who was having surgery today, who was actually asleep having surgery. And, said I had to call right now. So I scrubbed out of my case and I called United Healthcare, and the gentleman said he needed some information about her, wanted to know her diagnosis and whether her inpatient stay should be justified. And I was like, do you understand that she's asleep right now and she has breast cancer? And the gentleman said, actually, I don't. That's a different department that would know that information. And I was like, well, she does need to stay overnight tonight. And you have all the information with you because I got approval for this surgery, and I need to go back and be with my patient now. But yeah, it's out of control. Insurance is out of control. I have no other words. It's 2025 and insurance just keeps getting worse.
So essentially, a physician was in the middle of surgery. The patient was under anesthesia, and the insurance company calls into the operating room, stopping her from conducting the surgery in order to check, is this person really covered? Even though they approved it. Please react, please.
Honestly, it's not a surprise. I mean, I work in dental, so that's a little bit of a different beast when it comes to insurance, arguably far worse than medical insurance, but, like, that's not abnormal, you know? Things that they say they're gonna cover that they refuse to cover for X, Y, or Z reason after it's done, you know? Oftentimes, they just deny it, and then all the money gets, like, the patient has to pay it, and the patient can't pay that kind of money because our healthcare system is a bunch of different companies that are all working together to price gouge physicians, to price gouge the cost of care, and to make it impossible for the average person to actually afford anything. And the more that they do this, the more they're killing workers, the more they're disabling workers and making it harder for us all to fight back. You know, we had a mass disabling event that led to an insane rise of eugenics within the general population. I mean, they were fine with killing the elderly, they were fine with killing the disabled, and we're seeing the effects of that now. We're seeing the fact that, you know, United Healthcare is denying basic care. Like my own medication, I have a rare condition that I need to take medication for. I haven't gotten it covered since the beginning of this year. So I have been off of my medication and I have been getting sicker. And, you know, there's nothing I can do about it, despite the fact that, you know, I've appealed it, that my doctor has appealed it, and it just, they want us dead. They don't want to pay for your care and they want you dead. That's the end all be all, because the less people that there are for them to take care of, the less they have to pay. The more people that they can kill through denying care, the less they have to pay, the more profit that they make from, you know, these concierge patients, these rich patients that actually make money and can pay for private insurance and all of that. It, you know, like within dentistry, I assume all of you have had at some point dental insurance. It takes 6 to 12 months to actually get any procedures covered. You have to pay for insurance for almost a year, half a year to an entire year to get a filling or a crown covered. You know, you're paying for the insurance, but it's not covering anything. All it's covering is your cleanings. So if you actually have stuff to do in your mouth, they're just going to straight up deny it until you've already had it for a year. Like how is that, how does that work? How does that make any sense at all? Like to me it makes no sense. You're paying for insurance but it's not covering anything. Then why are you paying for it? You know, why are you paying for insurance if it's going to call in the middle of your surgery and tell you that you might not be covered or that it's not necessary despite you having cancer, despite the fact that you're already like under anesthesia? That's absurd to me, but that is the state of insurance within our current system. That is what insurance is made to do. It is made to deny you care. It is specifically made so that you cannot afford to live. I mean, most people in debt are in debt because of medical debt. You know, I'm in debt because of medical debt and I work in healthcare. How is that fair? Why can't I afford to get a filling done? Like, I know I have a cavity. I can't afford to get a filling done despite working in dentistry. How does that make sense? I have to rely off of the fact that, you know, hope that whatever doctor I get to work for when I get a job up here is going to do it for free for me. Like, because I can't afford to pay for dental insurance that isn't going to cover it for another 12 months, because at that point my cavity is going to be so big that I'm going to need a root canal, which is $1,500 to $3,000. And I can afford that. Nobody can. None of my patients can.
Yeah. It's also wild how we have insurances that separate the eyes and the mouth from the rest of the body.
Oh my God. So your mouth is the entry point for everything that goes into your body. If there is bacteria in your mouth, if you have periodontal disease, you are more at risk for diabetes. You're at higher risk for heart disease. You're at higher risk for developing certain kinds of infections. You can get sepsis and die from an infection in your mouth. There is a massive nerve and a big blood supply that goes straight up to your brain and down to your heart. If you get bacteria into your bloodstream, get sepsis, it's a lot easier to get sepsis from your mouth than it is to get from a cut on your finger. It has so much closer to your heart to travel, and they don't care. They don't care that these things can kill people. And I've always said that your class status signifies, like, your dental health signifies more to me about your class status in your childhood than it does about anything else about you as a person, you know? And dentists will sit here and blame patients. They will sit here and, patients that can't afford insurance or can't afford healthcare with insurance, they get mad at the patient and they blame the patient for not taking care of their health. When in reality, these people just can't afford it because it is $3,000. And with dental insurance, unlike health insurance, with dental insurance, once you hit your out-of-pocket maximum, insurance stops paying. Unlike health insurance, where once you hit your out-of-pocket maximum, everything's covered at 100%, typically. That's crazy. Why are there two different systems of insurance for dental and for healthcare? Why is the insurance that I'm paying for my healthcare not covering one of arguably the most important parts, because, like, if you don't have teeth, you're not able to get adequate nutrition, you're not able to get fiber and protein into your body, and that is a detriment to your health.
Yeah.
They are more interested in pulling teeth and making people incapable of getting proper nutrition, which is then killing them early. Patients are going home with massive infections, unable to afford care, and then going to the hospital and getting bunch of ER bills where all they give them is some antibiotics and some opiates, and that's it, and send them home. And then, they come to the dentist and they can't afford care there either. So they're just getting into more and more and more debt. And, there's all these different things like care credit, or like all of these like different credit cards that you can take out to pay for healthcare. But like none of that is actually doing anything. People can't afford care. People are dying because of this, like actively dying because of this. And, people, like, doctors see it, patients see it, and yet there's this like horrible, awful middleman that's, not like, you're paying for it. Why isn't it covering the treatment that the doctor says is medically necessary? Why is some guy that's not a dentist, that's not a doctor, that didn't go to school, making these decisions? They don't even like, and they have all these different, like, you have to call and you have to like sit on the phone for like 6 hours to actually get through to a real person. And it just, it's all meant so that they don't cover care. It's all meant to straight up kill you. Like like that that's what it is. It is straight up eugenics. They want the disabled people dead. They want people to like lose their ability to function within society. And they can keep making workers, and they can keep disabling workers, and as long as they're making a profit from it and not having to pay for the care, then they're not going to change anything, and nothing's going to change. Like, killing one CEO isn't going to change anything. They're going to put another CEO in place. We have to tear this thing down.
Yeah.
That's the only solution, is tearing everything down, because all of this is meant and created to suppress us and to keep us from accessing the care that we really, really need. They see sick people as surplus. They were fine with killing us during COVID. They were fine with continuing to kill us. I mean, if we look at COVID, it is still a thing. It is still a thing that is disabling and killing people to this day. And yet they don't care about it because they needed to push us all back to work to get a profit. And, and then they just like healthcare, because they realize that, they can do that. They realize that they don't have to cover anything, and that it's easier to just let people die. And like, it just, it's bizarre. It's a way of, if you're fighting for basic care, then you can't fight against the system. If you're fighting to get your care covered, to try and, get out of pain or survive or like anything, like, I assume everybody here has had a cavity. That shit hurts. That shit hurts really bad. You know, people are going to pay any amount of money, take out any amount of loans, any amount of credit to actually pay for stuff to get a tooth pulled because it hurts so bad. There's so many nerves up in your face that, like, yeah, and it just, they don't care. And the way that our medical and dental school system is set up, it's set up to put doctors in debt. That way they are only focusing on the money and not patient care, so that they perpetuate this system because, you know, unlike in the Soviet Union where all care was free, you know, like my family's from the Soviet Union. My grandfather died because he died in 2022 because he had not been to the doctor since 1991. Since the collapse, the illegal dissolution of the Soviet Union, where healthcare was free, where my mom got free healthcare for her scoliosis, where my grandma got free healthcare, where my dedushka got free healthcare. And, you know, once that illegal dissolution happened, then everybody had to pay for it. People stopped going and people started dying. You know, that's exactly what they're doing here, is they're trying to kill workers so we can't come together, so we can't rise up, and we can't actually attack the people in charge. It's crazy, it's mind-boggling, and we need to seriously talk about this because, you know, it's not just about like medications and surgeries, it's also about like the social determinants of health. You know, we need community. A lot of healthcare outcomes are often more determined by social determinants than they are by medical determinations. You know, the community, the clean air is health. Housing is health. Not having mold in your bathroom that you're exposed to every single day and breathing in spores, that is health. Housing is health. You know, all of this has to be taken into account. But if we break up all these systems into these little chunks that are ineffective and, like, you know, it just it makes it so inefficient and so difficult for patients to access care that it just kills them. It is just killing people. And like, it is a eugenics movement, and like, the only way to combat this is universal healthcare for everybody. You know, healthcare that, like, not the system that they have in the UK where you can opt out and have private healthcare that's so much better than the universal, like, public healthcare. It needs to be everybody is getting the same level of healthcare, everybody is getting it. The doctors are directly paid by the state. They will always do the procedures because they know that they're going to get paid. They don't have that risk of not getting paid. You know, they use their medical knowledge to make decisions, and they know that they're going to get paid. They know that the treatment's going to get covered. And that's the only way that we can combat this, because straight up, like, the system is created, like, it's all intertwined. It is all, like, health is very complicated, and breaking it down into these, like, parts, it doesn't make sense. And the only reason why they would do that is to kill people, you know?
Yeah. So I want to get into this part because as a medical professional, you're going to see this and it's going to be even more egregious in fact, because I might need to pause at specific points. I'm going to make sure I have this. Hang on. All right. So let me put this in here. I want to be able to pause, and for some reason, when you go straight through TikTok, you're unable to pause the videos, which I'm like, TikTok, come on, tighten up, do better. But all right, so let me see if I can do this here. All right. Yay. Okay, got it. Okay. All right, so let me share my screen and then we'll get into this. And please feel free to tell me to pause if you want to interject something from what is being said, because this is also this is going to be not really long, but it's going to be more a little bit lengthier of a video. So we'll get into this right now.
Hello, this is Dr. Elizabeth Potter. Who is this? Who am I speaking with? Can you not? So you're sorry. So there's also another wet. So you have two doctors on the call. Will either of you give me your name or MPI number or license number? The reference number for the call, but you won't give me your name or number, and neither will the doctor from Texas. Okay, please give me the reference number. Okay, and is the doctor from Texas? Would that person speak up, please? I'm good. Are you a plastic surgeon? What do you mean subspecialty plastics? I'm a plastic surgeon. I wouldn't say subspecialty. So you're an oculoplastic surgeon. What was your initial training in? So, okay, so we're speaking about lymphedema of the arm. So this is not an area that you're familiar with, correct? Oh, okay. Still practicing, but you won't give me your name? But you're my colleague in plastic surgery, and you won't give me your name. Yeah, I don't understand how it's connected. I understand that the CEO was murdered, right? But I'm your peer, and I want to have a conversation with a peer about a patient who has breast cancer and lymphedema, and I would like to know your name. How do I know who you?
That's crazy. Like, don't you want to give their name?
That's, they pay these people, and like it's all about the money. They're paying these people so that like they can essentially be traitors to their profession and work for these insurance companies. Like oh God, it's the entire system is made so that they don't pay for care. That's like the exact thing. Like it is specifically created for this. And like these doctors that are working for the insurance companies are traitors. They're traitors to their profession and they don't care about patients. They only care about the money that they're making from their their getting paid by these insurance companies. Like follow the money. Somebody that's being paid by an insurance company has a vested interest in denying care and making money for that insurance company because that's how it works. Like even the dentists that work for like Delta Dental, they're the same way. So like even if you get a doctor on the phone, they are they are meant to make it so that you can't get your care done because they are essentially bribed to deny care. That's what they're being paid for.
Wow. Okay, let's continue. Let's go back just a little bit.
How do I know who you are? How do I know that you're board certified and that you're a microsurgeon? Like how do I verify that? I'm just trying to make sure that I'm talking to an expert in this procedure with training that's commensurate with that. How do I verify that? So I can get your name from United Healthcare through this reference number. I'm I'm so sorry that this is to protect you as a doctor. I'm really trying just to do the right thing as a patient, and I also personally have been subject to threatening communication as well. I just want this to be the right thing. Okay, so I'm just going to have to trust you. You were asking me as a representative of United to trust you that you're a plastic surgeon and fellowship trained in microsurgery. So okay.
Trust me, bro. Trust
It could be
me.
anybody. It could be anybody on the other side. That doesn't there's a reason why we have NPI numbers. There's a reason why doctors have to link it to their license. There's a reason for this, and it's so that they can't just do stuff like this because that could just be some random guy. That could just be some guy saying he's a doctor. If they can't prove it, then why are they making these health decisions? That's and it's to protect you as a doctor. I've been threatened by patients because patients are getting denied care. I've been threatened by patients. They still know my name. You know, the people
You
that
know,
are actually working in healthcare, we're the ones that are getting threatened by our patients because their healthcare is denied, and it's not my fault. I'm not making the decisions, but like I'm the face. I'm the person that they are interacting with. So they're going to take their anger out on me, and I understand that, and I never hold it against a patient. But like these people sit here in their, CEO and in their like massive, buildings, and they make decisions that affect real people, and yet they can't even say their names. They can't even tell us who they are that are making these decisions. That's crazy. That's insane. I mind-boggling, truly.
please let me know if this is insensitive when I say this, and if it is, then I do apologize. But my message to private insurance companies is: if you want people to stop being their lives from being threatened, then stop denying care.
Yeah, no, that's not insensitive at all. That's basically what if you care about healthcare workers, then you will not put us in situations where patients are getting angry at us because we are the face of the healthcare system to them.
I'm
Most patients don't understand the intricacies of healthcare, and I don't expect them to. I don't want them to, and I don't expect them to, and they shouldn't have to. All they should have to do is come, tell us what's wrong, have us fix it, and then know that it's going to be covered. And us complicating it to this point is why patients are, physically attacking doctors, physically attacking nurses. That's why this is happening. That's why healthcare is so dangerous. It's not because, I mean, there's dangerous patients in general, like mental health issues and all of that, but like a lot of these people are just angry because they're getting killed by this, and they know that. And the only recourse that they have is yelling at us about it, you know?
Yeah. Uh, I'm gonna give a word of advice to these insurance companies. This word of advice is a phrase that comes out of the Black community. Don't let your mouth write a check that your ass can't cash.
Yep.
All right, let's
Yeah,
continue. I'm sorry. Go ahead.
no, it's just like this is I I just like I can't fathom, working in insurance and just like, they're so divorced from the patient experience and like the patient care process that they're like making all of these decisions and they're not even putting their name to it. They're not even putting their name to it. So you don't even know who's making the decision, and that is on purpose. That is so that we can't actually hold anybody accountable for the decisions that they're making.
Wow. Yeah, that's the sad part. Let's continue on. It keeps going.
Trained in microsurgery. So, okay, I'll trust you there. So, do you perform lymphovenous bypass? Have you performed it yourself for patients with lymphedema? Have you performed it yourself? So, have you been the primary surgeon in evaluating and performing lymphovenous bypass for a patient? Even one. You have not. Okay.
So they're tasking doctors who aren't even proficient at the procedure that's supposed to be approved in order to approve a procedure? That's
How are
like
these people?
wait, that's like asking that's like asking someone who is a baker to judge whether a butcher cut proper cuts of steak and pork.
The same thing
Like,
happens in
wait a
dentistry.
minute.
They hire general
I know
dentists to
about
make.
flour, I know about butter, sugar, vanilla extract, fruits, and all these other things. But when you're asking a baker to judge whether the cuts that are made from livestock is the right cuts, that don't make no sense. Yeah, they're both involved in food, but there's different sectors. There's levels to this shit. And this is what gets on my nerves with these healthcare industry. They're like, well, it's just the doctor. It's like, wait, if I play a doctor on TV, does that mean I get to tell doctors exactly what they should be approved of or not?
We have the same issue in dentistry. There's subspecialties, um,
Oh my god.
and they have general dentists making decisions for oral surgeons or making
Oh
decisions
my
about
god.
whether braces are medically necessary.
Oh my.
It's or like they have doctors making decisions about endodontics. Endodontics, that's root canals. And like they have general doctors who are like general dentists who are performing, fillings and crowns and restorative procedures, making decisions why a patient can have a root canal or not. And yes, a general dentist can perform a root canal, but if an endodontist is saying this patient needs a root canal, then who are you as a general dentist to argue with that? Who are you to argue with a person that then went on to do 2 to 4 years of extra residency to learn how to do this treatment day in and day out? Who are you to be saying that because you do like what, 1 to 5 root canals a year? Like, no. It's and the fact that they're not even giving their names and they haven't done these surgeries and like they don't know about this procedure. The body is so complicated. That's why we have all these specialties and subspecialties and these residencies and all of that because one person can't learn everything about the body. Nobody can. There's so much. That's why we have different doctors and different specialties. So why are we putting people that aren't the specialty into decision-making positions? That's wrong. That's like, of course these people are going to deny care because they don't actually know why it's important. Like, they've done everything to make it so that they can deny all of the care that you need and kill you. You know?
Yeah. Just because they're a doctor doesn't mean they're the right doctor.
I wouldn't trust. I no offense. I would not trust an endodontist to do my implant. I wouldn't trust an endodontist to do my implant because the endodontist is working on doing root canals every day. They don't know shit about planting implants into your mouth. I
Yeah,
wouldn't
I
trust
wouldn't trust
that.
the OBGYN to do anything involving
Heart
urology
surgery
on
or
me.
anything. Like you know, like it's you can't expect somebody that's specialized in one part of the body to make decisions about another part of the body. That doesn't make sense. That doesn't make sense to me. And that's why there's so many subspecialties. That's why there's people that are specialized in different conditions. That's why
Yeah,
there's people that are specialized. And that's why doctors are making the best decisions for their patients. They are intimately aware of
yes,
what their patients have, what their patients need, and the fact that like some other doctor that hasn't even done that procedure is making that decision, that's mind-boggling. That's crazy.
yeah.
That-
That's like a friend of mine who's a physician in palliative care, and she deals with people who are more at end of life. Why would you take somebody who's in palliative care, caring for people at end of life, and then say, okay, now we're going to put you in services being a pediatrician?
It's not their specialty.
Different
They
specialties.
specialize for a reason. These people go to school for years and years to specialize in specific body parts. The learning system is so rigorous, and yet why is somebody who has never even done a procedure making the decision about that procedure? That's insane. That's just not how life works. That's not how the body works. Nobody like I wouldn't want to be making decisions about anything to do with anything other than the mouth. I only know about the mouth. I don't know anything about the eyes. I don't know anything about like the heart or anything. Like I mean, I
Yeah,
know like the basics that I need to know for like working in dental, but like I would never trust myself to make a decision about like a lumpectomy or whatever procedure she's talking about because I don't know anything about that. Just because I
yeah,
work in healthcare doesn't mean that I know everything about health. That's not how life works. That's not how bodies work, and that's not how it should work.
yeah. Oh my gosh, this is crazy. This is so crazy. I
We're
would
only
be
2
pulling my
minutes in.
hair out if I was this doctor.
Okay. Do you treat patients with breast cancer currently and do microsurgery like deep flaps or lymph node transfers or lymphovenous bypass? You have a cosmetic practice currently. Okay. Okay. Do you do microsurgical? Okay. Do you do microsurgical breast reconstruction currently? So you're not doing microsurgical breast reconstruction currently or treating patients with lymphedema currently. Okay. So the patient that we're talking about is a physician, and she is going to have an axillary dissection and radiation. And her risk of lymphedema is, I'm assuming you know. Do you know? Do you know what the No, it's important. The specifics are important. Do you know the specific risk, like the documented risk for her, like the percentage risk of lymphedema? No. She absolutely will need radiation. If she's having an axillary dissection, she's going to have radiation. No, so she's been to see us in clinic. She's had further evaluation. She is going to be having an axillary dissection and will need radiation. So do you know what her risk of lymphedema is? Well, I mean, I think this is part of the issue. If you're my peer, then I think you should be able to answer that question because that's an important statistic, certainly for my patients who have lymphedema. Uh-huh. So her risk of getting lymphedema is 40%. And we have the ability to reduce that to 10% using a lymphovenous bypass. And that's the information that I want you to carry back to United. And I will do the appeals and all of that. But that's the piece of information that I want you to have going forward. So you don't have the ability to approve it in your role. Okay. This patient I'll appeal. Again, I appreciate your time. I don't think you're my peer in this area. I don't think that you had the specific details around this procedure. You haven't performed it yourself as a primary surgeon, and you're not actively treating these patients with microsurgery. But I appreciate your time and calling, and I'll continue to reach back out to United. You too. Thanks.
This is insane. I did also want to mention the comment from Cobra Commander. Plastic surgeons do treat cancer. They are often one of the treating doctors for cancer. That's part of like their specialty is like because like when you're removing like tumors and such, you have to be able to like get the cosmetic portion of it together as well. So they are they are they are treating it, but like not every plastic surgeon is going to be a plastic surgeon that treats cancer same way. Not every oral surgeon is going to be an oral surgeon that treats cancer patients. Some of them are specialized in different things, even though they have the same overarching like treatment. They subspecialize underneath that.
Yeah. So it basically is there's ones who do like reconstructive surgery for medically necessary means versus ones who do it for cosmetic, right?
Yep.
Like
Yeah.
somebody who does a
Exactly.
rhinoplasty for cosmetic reasons is different than somebody who has to do plastic surgery to repair a deviated septum,
Yep.
right?
Yeah. Exactly. So like, there's doctors that are primarily in the cosmetic industry, and the same thing happens in dentistry. I mean, it's not a real specialty yet, but there's like cosmetic dentists that primarily. And yeah, you would see a radiologist first, but this patient clearly has gone through that, and this patient is a physician that has gone through the point where like now she's with a plastic surgeon who's doing that breast reconstruction, and removing that breast tissue, because like it's a plastic surgeon's also doing top surgery and stuff, so doing a double mastectomy, um, that's a typical procedure for a plastic surgeon to be doing because like that is their specialty. You wouldn't want like a cardiovascular surgeon to be doing your double mastectomy because they're not specialized in that, and they wouldn't be able to get you a good closure or anything. um they're probably not good at as great as doing like sutures because like they're dealing with like internal body systems versus external ones. It just medical, that's why it's so complicated. That's why even though they're both plastic surgeons on the call, supposedly one of them won't even give their like they won't even give their phone number or license or anything, but supposedly they're both plastic surgeons, and one is primarily treating cancer patients and the other one is doing a cosmetic practice. So like that is something that just because people have specialties that don't like intuitively seem to connect, that doesn't mean that their specialty doesn't actually like deal with these kinds of patients. But like that's how these insurance companies get away with it. That's how they get away with it. They get these people that have never done these procedures, that have never interacted with patients like this, and then they make those decisions without any actual knowledge. Like the guy can't even provide information about, how much the percentage of this woman developing lymphedema is. And lymphedema is a very disabling condition. The swelling of your body parts, the inability, like people can lose ability to like move their limbs because they're so swollen. And it, it just it's crazy that like they can't even answer basic questions, and they're calling themselves peers when they're not peers. They're not specialists in the same thing. They're simply just doctors of another specialty of a different name. Like, sure, if this guy was making decisions about whether or not to cover like a breast enhancement, I trust his decision there because he's a like plastic surgeon. But this woman is like a cancer plastic surgeon, or subspecializes in cancer in some capacity. So I would trust her decision making about this specific patient and over any other physician, unless they have the exact same specializations and are treating patients of a similar caliber. And if they're not even willing to provide their names or their license numbers, then they shouldn't be making decisions. You should be have to, like, I have to put my name to all of the notes that I write, and I don't even have like a license that can be, like, I don't have a license that's able to be like really taken away from me because I'm working underneath the doctor. But despite that, my name is still there. My patients are seeing my face. They know that I'm there helping them. I don't want some nameless, faceless physician making decisions for my patients, you know? They don't even see the X-rays. They don't even see any of this. And they're even if they did, they're not able to actually like accurately tell what the patient's risk is, what the patient needs. You know, only the doctor that is like intimately familiar with the patient's experience is the one that should be making the decisions. It's not some random person that is being paid to deny care, because that's what they are. They're paid to deny care, you know, and they should not be making these decisions. They should not be doing this. And the fact that our system has allowed this is crazy to me. And like the reason they allow this is because the sicker workers are, the more disabled we are by COVID, the more disabled we are by denied care, the less the less energy and the less power that we have to fight against it. You know, that's like basically explicitly the reason why these systems exist, is to deny care and to make it more difficult for members to get their care, you know, covered. And I mean, like we fight all the time with insurances. We're calling them and we're being like, you know, who actually denied this care? We sent the X-rays. You can see that the filling, like that the cavity is like huge in the tooth. They obviously need a root canal, and then they're like, oh well, you can try just doing a filling, and it's like halfway into the pulp cavity. Which if you do a filling on the pulp cavity, that person's going to be in severe pain. So they need a root canal to remove the nerve so that they're not in pain. And yet they're like, well, you should try a filling first. And then if you try a filling and it doesn't, like, the patient has already used up $300 of their insurance to pay for that filling, but they only have a max of 1,000, which means that they only have like 700 left, you know? And then insurance will still deny it because they're like, oh, you already worked on this tooth this year. Like, it's straight up like all of these companies are made to deny you care. They're made to make you sicker. They're made like we saw it with COVID. COVID was a big catalyzing event for this, for allowing disabled people, allowing the elderly to die. And you know, they started spreading all of this propaganda about like COVID being a scam and stuff, and
I
that
have to be careful with the COVID
oh, okay.
subject. Yeah, because YouTube will still like, you know,
Really?
yeah, yeah,
That's crazy.
yeah. I
Wow.
know.
But
Yeah, we have to talk
you
about.
know,
I
we
don't
had
even
a mass.
I don't even use the c word. I just say
Okay,
pandemic
I will
because
stop
that's
using
how
it then.
bad it really is. Like there have
But
been channels that have been, you know, go through strikes and stuff because of it. It's wild.
then
You
that's
know.
what they're doing to kill everybody. They don't want you to have the ability to fight back. The more they disable you, the harder it is to fight back, and that is what they're doing. And it's you know, all of these things, like they're getting doctors that aren't even specialized in these areas, and they're paying them, they're bribing them. You know,
Yeah.
if
Yeah.
somebody's being
Ooh,
paid to deny care, then of course they're going to deny care. If you know their interest is in making the insurance company the most amount of money, then the way that they're going to do that is by collecting your premiums and then not actually paying for anything. That's how they make a profit. Because if they actually had to pay for care, then they wouldn't make a profit, and then
yeah.
the CEOs wouldn't make anything.
Yeah. You know, and a lot of people, Lex, would ask, you know, well, what is your solution then if we can't have privatized healthcare? Because we like our choices, we like our options to be able to choose which healthcare system, which private healthcare we want. What would be your answer to that?
A universal healthcare system, one that everybody is covered underneath the exact same like state run institution. There is no private option, that it has to like that doctors know that they're going to be covered by the insurance companies because it is the state that is providing that care, similar to what they had in the Soviet Union, you know, similar to what they have in other countries with healthcare, where I mean there's not, almost all countries still have a private healthcare system, but that private healthcare system is what is causing all of these poor health outcomes, you know. And not just that, but also taking care of housing as part of health, taking care of clean air as part of health, clean water and food as part of health. You know, it's all intertwined, and it all has to be you know, it all has to be taken in tandem together, that all of these things are determinants of health, and that these determinants of health are necessary to improve patient outcomes, to improve patient health. And that like it has to be paid universally, it has to be covering everybody equally. Otherwise, some people are going to get left behind. That's if the I mean, okay, listen to this. How much are you going to pay to get out of pain? How much are you going to pay to not die? How much debt will you go into to get yourself out of severe pain? Like, I would pay anything. I would pay anything. If I'm in pain, I would pay anything. You know? Like, that's just like most of my patients would pay anything to get out of pain. They would put themselves into severe debt to get out of pain, and people do. The greatest debt, the greatest reason for debt in the United States is healthcare. And that's because people will pay any amount to survive. Like, we are at the core self-preservatory creatures. We want self-preservation, and so we will pay anything. We will do anything to survive, and they know that, and they capitalize upon that. And it's it's frankly evil. It is so evil. It is it's disgusting, and it is something that we fight against every single day at work. Every single day we are fighting against this system that is straight up meant and designed to kill patients and to make it so that people can't survive, because if you die, they've collected all of your money and they never had to do anything with that money to pay for your healthcare. And so they've already gotten everything they can out of you, and so once they start denying that care, then you just die. They've already gotten all of that they can, and because they don't have to pay out anything to you, because they can deny it with these doctors that won't even say what their name is. It just it is straight up meant to kill you, and like people need to understand that like healthcare is one of the most important things. Like healthcare disparity is one of the things that is destroying our world right now. It is it is something that is so necessary, that is so needed. Like, and it's all intertwined, like even if we had universal healthcare, if we don't have universal housing, if we don't have universal food or water and all of that, like it just it that means that the that even if you get the medicine that you need, if you're drinking poisoned water, if you're breathing poisoned air, if you don't have a house, if you're exposed to the elements, that means that doesn't matter how much medicine you have. If you get surgery to remove something, I met a man while doing mutual aid who had gotten a surgery on his arm to remove a tumor, and then they just put him back out on the streets. And it got infected, and he has this massive infection on his arm, and everything's growing back because he's not actually getting any care right now. They just, they did what the bare minimum, and then they shoved him back out onto the streets. And you can't heal on the streets without good water, without good food, without like decent rest. All of that is necessary for health outcomes. And, because they've split all of this up and because they've cut it all apart and they've made the decision making parties not actually like have to deal with patients. These people are sitting there and they're on calls and they're making these decisions for the doctors that are actually like they have medically relevant training, and they're having these people that don't have medically relevant training making these decisions. It just doesn't make sense. It's not logical, it's not rational, and the only reason that I can think of is so that they can kill people. Like that's the only reason I can think of for why our system is like this, because they get as much money out of you and then they kill you and then they move on to the next person.
Yeah, that's the sick and twisted part of the system. And there's no reform in it.
No, there's
One
no
of my
reforming
most
this.
radical opinions is that we should have a fully nationalized healthcare system.
Yeah,
And
I
a
don't
lot of
think
people
it's a radical
say,
opinion.
well, people say, well, we need Medicare for all. I'm like, no. I'm like, that's not good enough.
No.
Medicare for all is not good enough. Single payer healthcare is not good enough. I say we have no insurance, just healthcare.
Yeah.
Because, like, why are we sitting here trying to see, like, how are we going to pay for it? It's kind of interesting when people are like, well, how are you going to pay for it? Number one, if we didn't have to give all these subsidies to the fossil fuel companies, subsidies to big pharma, subsidies to all these big corporations that are harming our planet, then number one, we would actually have more money in our government, more federal dollars to be able to
If
spend.
we weren't giving billions of aid to Israel.
Yeah, we weren't giving billions of aid to Israel, right? If we weren't doing all that, then on top of that, if we weren't giving all these tax breaks to these billionaires and damn near trillionaires and 100 millionaires, then that would be also more money that's left over for us. And so therefore we can actually be able to afford it. But then on top of that, if you give universal housing, a housing first model, if you start to make sure that everybody has clean water, if everybody has a measure of healthy food for them to eat without ever having to go hungry, then that actually makes your healthcare outcomes even cheaper because therefore, if
Yes.
they're less likely to have to use the healthcare facilities in order to be able to use them all that often. And a lot of times you get a lot of people who, especially who consider themselves to be conservative, go, well, if we give people universal health care, they're going to overuse it. I mean, you mean they're going to make themselves healthier?
Nobody's going to the doctor for fun. The doctor isn't a fun experience.
I sure as hell don't go to the doctor for fun. Do
Nobody's
they
going to
think
the
that
doctor
I
for
get
fun.
some twisted joy out of being stuck or getting a central line put in my neck? Trust me, I know. I've had it before. Do I get
I don't
some
get joy from
crazy
stabbing myself every month and making
sensation
myself
out of getting an
immunocompromised.
arterial line in here? Right? Do I enjoy being intubated? No. It's crazy. So why in the world are people it's wild. They're like, oh, they're going to use it too much. No, they're going to use it to the point where they actually are well taken care of, and that's what people don't want. Because here's the problem. I'm gonna say it right now. Some, not you, but
Mm.
some people have the opinion that some humans are better than others. And so, therefore, some people are considered more worthy
Inherently
of
more
health and
deserving.
life than the others. And that is bullshit because every life is worth the same amount. Life is invaluable. All life is precious. And if you truly believe that, then that means that all people should have healthcare at the highest quality, no matter what. Therefore, they should not be paywalled to live. And that what makes me sick. And they're like,
It
well, do
straight up
you
makes me
want people to
nauseous.
have to work for free? I'm like, no, we'll do it just like we do with all the. Look, how many of these people who work for the government that are paid handsomely for what they do, and they don't do a goddamn thing even worth a shit for us? Like,
Yeah.
I'd rather pay doctors, nurses, techs, all these people in healthcare more than some of these politicians who say that they're with us, but then they'll actually do a damn thing for us. Let me give the money to the doctors. Let me give the money to the nurse practitioners. Let me give the people who actually clean the hospital rooms, who keep infectious rates down. Let me give the money to
They're
them instead.
just as
I'm not giving no
important.
money to damn Nancy Pelosi or Chuck Schumer or Mitch McConnell. What the hell? And I
No.
damn sure ain't giving money to people like Marjorie Taylor Greene or AOC. Get the hell out of here with that. I'd rather give it to people who's actually going to materially help me. I'm sorry to go off, but it just gets on my nerves.
No,
And
you're
I
right. And also,
3 months ago.
with health insurance being tied, like Vicky said in the comments, with health insurance being tied to your job, that is deliberate. That is meant to make it so that you cannot leave your job for another position
Yeah.
because you are scared of losing your health coverage. Because if you have children, if you have disabled spouses, if you have anybody that is relying on your work for their health care, then you are trapped. You are trapped in you are trapped in a job, a dead-end job that is treating you like crap, and you can't leave because other people are relying on your health or you're relying on the healthcare that you get from that position. And that is deliberate, that is intentional.
Mm-hmm.
Exactly, Amy. It does trap people suffering from domestic violence and abusive partners because their healthcare is tied to their abusive partner. You know, that is exactly correct. It is meant to keep people trapped. It is meant to kill people, and it is meant to make it so that we cannot fight back. And that's exactly the explicit purpose of the system is to make it so that we can't fight back, so that we're too sick to fight back. You know, and costs of health go up. Preventative health is a lot cheaper than doing expensive surgeries. It's the same in every single healthcare field. It's the same in dentistry. Preventative is so much cheaper and so much easier than having to pay $3,000 for a root canal because you've let it go on for 2 years and now it's so painful and you're at risk of sepsis. And that's the explicit purpose of this system, is to make it so that we are trapped within our jobs, that we are trapped within the working conditions that we are born into. And so that we can't move, so that we can't do anything, because everything is tied to healthcare. Everything is tied to insurance. And, you can't, and all the insurance is crap. I mean, it's all crap. You have to pay like what, $3,000 before it even kicks in? What? How is that fair? How is that? Why is that a thing? Why do you have to pay $3,000 before your insurance actually works? Why do you have to
Yeah.
wait a year before you can actually get a root canal? There's no logic behind it other than making profit.
Yeah.
And that's it.
You know, it's even cheaper. Making sure that everybody has healthy whole foods to eat so that their health is sustained, so that they wouldn't even have to go, so that when it comes to even just the maintenance part of healthcare, it goes a lot more smoothly,
I
right?
mean, I
So
live in Iowa where corn is grown, a lot of corn. And corn is subsidized. And, because corn is subsidized, they're putting all these corn byproducts into our food, high fructose corn syrup. That's not a natural ingredient. That is something that is a byproduct of corn processing. Um, and, if we actually grew stuff that was, actually native to where we're living, like Real is doing with the farm, and providing healthy food to people that live in the Orlando area, that is that people wouldn't be getting heart disease as much if they weren't getting shoved full of high fructose corn syrup. Diabetes wouldn't be as big of an issue if people had access to healthy and nutritious food, if they had access to housing. People wouldn't be getting sick and have their immune system compromised because they're living on the streets. You know, that like if like when I lived in Orlando, I lived in student housing and there was straight up mold growing in my bathtub. And I got sicker. I got sicker because there was mold growing in my bathtub that I couldn't get rid of no matter how much I bleached it. You know? And if we got these, if we took health holistically in its entirety, as housing, as food, as water, as air, all of that is part of healthcare. Heck, even community is part of healthcare. Straight up having somebody to listen to and talk to, that's part of healthcare. Having somebody that's there to take care of you when you're sick, that's part of healthcare. You know,
yeah,
it's not just the doctor and the surgeon, it's also the nurse or the CNA that is taking care of you post surgery, that is changing your diapers, that is changing your lines. All of that is part of healthcare. And
yeah,
yet, all of these auxiliary staff, they all of these auxiliary staff are being paid pennies, and they're often people of color, and you know they're often people that are coming from immigrant communities. Within dental assisting, we see um a lot of DAs are foreign doctors. They are doctors from other countries that came to the US for a better life, and then they get pushed into the same position that I'm in, and oftentimes because they're immigrants are getting paid less. I knew a woman from Ukraine, from the Donbas region, who came here, and she was getting paid $14 an hour for the same position that I was being paid $17 an hour. And she was an ENT doctor, a doctor who went to medical school, and she was getting paid less than I was. That is crazy. They are explicitly targeting women of color into these care positions where they're getting paid 12, 13, $14 an hour. I mean, like a lot of the people that are in the same job field that I'm in are often, people of color that are immigrants that, young women that are coming out of high school that are getting put into these schooling that is it costs like $25,000. I'm so serious. It's expensive to become a DA, and then they're getting paid $14 an hour and they can never pay down their debt. And it's getting marketed as an easy job in healthcare when we're actually doing all of the labor. We're doing a lot of the labor to support everything, to support what the doctor has to do, and yet they're underpaying us, and they're not, and they're tricking people into going to these incredibly expensive schools, and then they have to pay, and then they're stuck in debt and they're trapped working in the same field forever. And a lot of these positions are also disabling. Doing manual labor, and that's what healthcare is. It is manual labor. it can disable you. Dental assistants have higher rates of deafness, they have higher rates of back injuries, they have higher rates of disability in general, because you're hearing that drill all the time, and I know women that went partially deaf from it. I know women that have spines that are messed up, that have spines, like spinal issues that come from hunching over a patient their entire life. Neck issues, I have experienced neck issues, and I'm 22. I shouldn't be in severe pain every day at work because they won't provide a loops for me that I can look at the patient and have, glasses that help me see, so I don't have to bend over and hurt my neck every single day. But, that's, these CNAs are doing the majority of the labor. They're like the CNAs, the HHAs, the DAs, all of these assistant positions are doing a lot of the manual labor, and they're getting disabled by it, and they're not getting paid anything, and they're not able to afford to live, you know? And they see these jobs as, accessories, and they don't see us as important, when in reality, we are probably one of the most important positions in healthcare, because without us, it wouldn't run. Doctors don't even know where stuff is kept in the office. I'm the one that knows where stuff is kept in the office. If the doctor had to set up the room, they would take 3 hours to set it up. I can do it in 15 minutes. And yet, people in my position are being paid less because they're people of color, because they're immigrants, because they're not as good at speaking English, And then American doctors will straight up make fun of these people. I've had plenty of doctors talk crap about foreign dentists that work for them to my face, because they think that I'm some ally that also hates foreigners. I don't, and that's very common. That is scarily common, where these people are getting underpaid for positions, while, white Americans are getting paid higher for the same position. It's just it's it's so insidious, and it's so disgusting, and the entire healthcare system is built upon this. It's built upon the labor of people that are getting underpaid for their work, and that are getting disabled by their positions as well. Because if you're a CNA that is having to move a very heavy patient by yourself, you're going to develop back issues,
Yeah.
but you're getting paid $12 an hour, and then you don't have insurance to pay for those back issues that appear later on in life, that you can deal with them when you're young, but as you get older, it gets harder and harder and harder to deal with these conditions, and yet your insurance doesn't cover it. So you've devoted your life to taking care of other people, and then you've become disabled by it, and you can't even pay for healthcare. And that's what it's meant to do. That's what it's meant to do.
Wow.
Sorry
Wow.
for this. Is people don't understand that these positions that are these auxiliary positions, that's what they're called, are just as important as the doctor, as the nurse. And oftentimes they're the ones that are doing most of the work with the patient, most of the interaction with the patient, and actually keeping the office running. And yet they're the ones that don't have health insurance at all, and are getting paid, $20,000 a year, $30,000 a year, and can't afford rent. That's why I moved here, because I couldn't afford rent. I couldn't afford rent in Orlando, despite working 40, 50, 60 hours a week when I was, taking temp shifts on top of my full-time position.
Wow. Wow.
You know,
Yeah.
it's
It's wild, man, as far as the healthcare system.
it needs to
Uh
be torn down, and like that's the only thing I can ever say, is that it needs to be torn down and built up from scratch, and from scratch by patients, for patients, by physicians, for patients, and it needs to be universal, and everybody deserves the same access to health, and we need to take into account all of these other determinations of health. There's actually two very good books that I mentioned to you, Health Justice Now and Health Communism, that both cover this very, very well. And they show you the importance of needing that universal healthcare, and that these stopgap measures that the UK has are not enough. Um, so I'm reading the chat. Jacqueline said, "Oh, why don't they teach patients from childcare the importance of dental care, and not just treat it as important based on aesthetics or on how white your teeth are?" Because the dental system has like oftentimes for youth, they only spend 25, 30, 45 minutes per patient, and they're trying to get them in and out of the chair because they can want to bill as much as possible. So I've been fired from jobs for taking the time to educate my patients. I, you know, um, they focus on aesthetics because, they can bill more and they can like push these veneers onto people that are actually damaging for your teeth. And they can make it so that people feel bad and feel like it's their fault for what they weren't taught as children. People aren't taught the right way to floss. People aren't taught the right way to brush their teeth. And then they can bill them more as they age because they need more care. Um, they're spending, I've had offices where I was only allowed to spend 15 minutes per child patient. 15 minutes for the entire appointment is 15 minutes. I have to clean the room, clean the patient's teeth, and educate the patient within 15 minutes. That is impossible to do. That is impossible to do. You can't do that. And these kids are getting left behind. They're not taught proper care, and then they're having these dental issues pop up later in life that they then have to pay thousands of dollars to fix because like I said, how much money are you willing to pay to get yourself out of pain? I don't know about you, but I'd pay any amount to get out of pain. When I'm in pain, I just want to get out of pain and I don't care how much I'm paying. you
Yeah.
know so it's all created for profit, and once we take out the profit motive, then we can actually have equitable care. The profit motive is what is destroying healthcare in the entire world. you know
Yeah.
it's you can't mix profit and health. You can't do that. That's never going to work out, and these insurance companies know that and they're weaponizing it. And they're paying these, like in that video, they're paying these doctors that don't even have any specialization in the procedures that they're denying, and that they're denying them based upon the fact that it is just it's so awful to watch getting patients get denied, and then practitioners blaming patients for the way that they react, and practitioners blaming individuals for their outcomes. I have always said, your teeth tell me more about your socioeconomic status than they do anything else. They don't tell me about how good of a person you are. They don't tell me about how, whether or not you're deserving of care. All they tell me is whether or not you are poor. All they tell me is whether or not you were homeless at any point. That's what they tell me, and when I'm handing out food and doing mutual aid, I'm seeing all these people with horrific health conditions that I can visibly see. And you can make that decision, like it's a split-second decision, and that's why they prioritize aesthetics, because if your teeth are bad, people are going to make that split-second decision and decide that you are a bad person because you have bad teeth. And they did the same thing. Diastemas, which you have, the space in between your front teeth, is something that is commonly seen in the Black community, and there has been a deliberate effort to make it so that that's seen as ugly, you know, and so people are getting braces and veneers to fix that when that's not something that actually is in any way impacting your oral health. That space doesn't do anything. And then they're teaching people that they don't need to floss between those teeth because they have that space, which isn't true. And so Black and brown people are having higher rates of periodontal disease because they're not taught proper hygiene, because oftentimes they're poor and they're going to Medicaid offices that don't actually care about teaching patients. And that is education is important. All of the other determining factors of health are important and need to be pushed, but because we're trying to bill as much as we can to insurance, we're not taking the time to teach our patients. I've worked in concierge offices. I've worked in offices. I've worked in Medicaid. I've worked in concierge offices where the doctor spends 4 hours with a patient and the patient pays like $5,000 for like a single procedure because the doctor is spending so much time. And the difference is mind-boggling. The difference in the way we treat patients based upon how much they can pay. Even within offices that take Medicaid, I've heard of doctors giving different toothbrushes to Medicaid patients than they give to private insurance patients. That's a thing. That's a thing that people do. Like you're not supposed to. You're not supposed to do that, but that is a thing that people do. Like They straight up, like, Medicaid patients, they see them as, like, the bottom of the barrel, and they don't see them as deserving of healthcare, and that's why giving everybody universal Medicare isn't ever gonna work, because these doctors still have those preconceived notions about these patients that they don't deserve healthcare, that they don't deserve help, because they're not gonna get paid for it. I've had doctors use expired materials on Medicaid patients when they use non-expired materials on their private insurance patients. This is so much more common than you think it is. It's just and nobody's talking about it, nobody's mentioning it, and there's this cult in dentistry where you don't want to talk bad because patients don't trust dentists, and I get why. I understand why patients don't trust doctors, patients don't trust dentists, because they are doing these horrible things and then gaslighting their patients about it. They're blaming the patient for the fact that they have bad teeth, when in reality it's because when they were a kid they didn't have access to a dentist. As an adult, it costs thousands of dollars to fix what was broken already, because they never had access, and because these dentists in their youth never taught them how to do stuff. And I'm trying to talk to my patients, but I'm just one person. I can't, change everything just by spending more time, and I get penalized for it. I've gotten written up for calming patients down, for spending extra time to calm a patient down. I got written up for that one time by the DSO that I worked for, which is like corporate dentistry. Like it's so corrupt and it's so gross, and they're all working together, and the way that our education system is set up is specifically made so that these dentists are put into debt, these doctors are put into debt, and then all they think about is the profit, all they think about is the money, and that's the only thing that is motivating them. And they do that on purpose. They make it impossible. And that's not even to mention the nepo baby dentist, that their grandpa's a dentist, their dad's a dentist, and they're a dentist, and they pass down these offices down to them. So like the people that are getting into dental school from scratch, they don't have that like generational wealth behind them. So they're often having to like catch up with other providers, other dentists in their field. And that happens in medicine too. And that is, they're all working together to make it so that patients can't have care, that way patients get denied care, and only the rich ones are able to actually get decent care. And if we have any sort of private insurance, any sort of anything like that, that's going to keep happening. So having a system like in the UK where it's there's that public healthcare system, and then there's the private healthcare system. You can only access better healthcare by paying more, even when that free system exists. And like that's why Medicare for all won't cut it. The only thing that'll do it is universal single payer healthcare, which the single payer is the government, the state, you know, and the state automatically always covers whatever the doctor deems medically necessary. That's the way we have to do it, and that's the only way that we can actually deal with this issue. And dealing with housing, dealing with water, dealing with all of the food. The food is so important, you know the fact that we've subsidized these corn companies and are now shoving high fructose corn syrup down people's throats, and we're expecting people to not get diabetes. Like, how are you expecting people not to get diabetes when the sugary high calorie food that has no fiber, that has no protein, that has nothing that's actually healthy for you is getting shoved down your throat? Because it's so much cheaper to buy $2 worth of donuts than it is to cook you know a fresh meal. And like it has to be torn down. That's all I can say, is that it has to be torn down, and everybody's suffering, and it's not just patients, it's providers, it's auxiliary healthcare workers. Everybody is suffering from this system, and yet they've tricked us into thinking that this is better than having a single, like, have everybody having equal access to healthcare. They've tricked us into that, and it's insidious and it's gross and it's disgusting, and we really need to do something about it. Seriously, something needs to be done, and the only thing that can be done is organizing and getting out in your community and showing strength and worker solidarity. That's the only way that we're going to do it, because reform is not going to work. These companies, they have all the money, they have all of the resources, and they're not giving it to anybody but the rich. The fact that I know dentists that have used expired materials on Medicaid patients versus non-expired on private insurance patients, that alone was like, within 6 months I became a communist. I was always like a sock dem when I was like a teenager and stuff, but like within 6 months of working in dentistry, I straight up became a communist, because like and they tricked providers and health professionals into thinking that it's the failure on the patient's individual like it's on the failure on the individual patient, when that's not the case. It is systemic. It is a systemic issue that needs to be dealt with systemically.
And we haven't even gotten to the racial aspect of how a
Oh
lot of
my God. Dentists, okay. I have been arguing about this my entire career. Dentists still expose Black patients to more radiation because they think that Black patients have denser bones.
I'm
I'm
sorry,
sorry, but if
they have what?
denser bones.
They think I'm getting hot.
Yeah.
I'm getting hot.
Sorry, but like that's like
I'm getting hot.
straight up, you know, like and if you're exposing Black patients to more radiation, then they're gonna have more rates of cancer. Like it's something that I've been told my entire career that I have to expose Black patients to more radiation. I never do it because I know that's not true. Like, I've taken enough x-rays in my career that I know for a fact that that's not true. But, like, obviously a 6'2" guy is going to need more radiation than a 5'2" woman. But, like, that's nothing to do with their race. That's to do with their size.
Yeah.
Like, it's, and this is so prevalent. It's so prevalent. I've been told that like Black patients are just more likely to have gum disease, which is just not true. It's a bacteria that causes gum disease. The prevalence of the bacteria is what causes it, and the lack of healthcare and the lack of education is what causes the extra growth of bacteria. Yes, Black patients are more likely to have more dental issues, but that's because Black patients are more likely to be poor. They're more likely to be on Medicaid, and they're less likely to have consistent access to care. So they are going to have more issues. That is true, but that's not because of their race. That's because of like material conditions that have impacted their access to healthcare. The lack of reparations, the fact that like, they're only allowed to go to certain dentists. And like a lot of dentists no longer even take Medicaid. There is one office in the entirety of Iowa that takes Medicaid insurance for children. You know,
Oh my
like
God.
there's one office. So, it's 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 crazy to me. It's crazy that like we're blaming patients for the fact that they can't get in to see a dentist, and that they have bad dental outcomes. And then we're blaming race on top of that without actually like analyzing where this comes from. We can't do that. That's awful. That's disgusting to me. Like the fact that I've been told that I need to expose Black patients to more radiation, like I looked it up after, actually like getting told it the first time, and I was like, that's not even true. And then if I try to argue, you know, they're told, oh, the dentist is the one that knows everything. And I'm like, okay, but the dentist is like straight up spreading racist propaganda that has been debunked so many times by so many studies. And the fact that Black and brown people are less likely to have private insurance and less likely to have consistent access to care doesn't mean that their race makes them more prone to these things. That's not how healthcare works. You know, like sure, genetically there are certain conditions, but like that's that in health in dentistry we know that it's caused by the bacteria Streptococcus mutans, and it's not like Black people have more bacteria in their mouth. That's not how that works. You know,
It, okay. This, gosh, we could talk about this all day. Look.
yeah, we can, and like the thing
Oh my
is,
gosh.
they trick Black dentists into it too. They trick
Yeah,
Black dentists into it. I've been told that by a Black dentist. A Black
wow.
dentist told me that I need to expose Black patients to more radiation. I argued with him. I argued with him, and I didn't do that. And my X-rays always turned out fine. My X-rays were always great. You know, um, and it's like they spread this propaganda into our providers, and then our providers perpetuate it, and people like it's it's crazy. And like I've been yelling and screaming about this for years, and nobody listens to me because I'm just a DA, because I'm like, they can replace me very easily by getting some 18-year-old girl that went to 3 months of dental school that she paid $25,000 for, and she didn't actually get trained in anything, so she's having difficulty finding a job, and then they underpay her by paying her very little. And because I'm actually experienced and I can speak out against this, they'll fire me, or they'll write me up. And like it's it is so rampant. The racism in dentistry, in healthcare in general too. How they won't give patients painkillers if they're black. They're less likely to give them stronger opiates. Like that is straight up like something that happens. Oh my god, there's studies where they used to say that like black patients were less likely like have like a higher pain tolerance. That's just not true. That's not how nerves work.
No,
The color of your skin has nothing to do with the amount of pain that you're in, you
no.
know?
And I've actually did a story about how being a patient that was on dialysis, how they actually used to measure the I think it's the GFR for
Yeah, they measure it
health.
differently.
Yeah, they measured it
And then
differently. They
that way
actually
black
changed it
patients are less
recently.
likely to get kidney transplants. You're exactly
Yeah,
right.
yeah, they changed it so that it's now race neutral, but it used to be for years
I
that
think they
they
only changed
would
it like less than
be.
5 years ago.
Yeah, it had to be. It was within the last 5 years that they actually made it race neutral, but they made it so that if you had a certain creatinine level that was higher, if you are black, they would say, "Oh, you're close, but you don't really need dialysis." But if you're white and you had that same levels, then they would say you would need dialysis, which means that black people were more likely to go into kidney failure
Mhm.
and have more severity because they were being underdiagnosed. And it's the same thing with pulmonary issues as well. Even in the testing for different medical devices like the pulse oximeter, right? It's being tested on white patients, but it's not being tested
Yeah,
on black
and
patients. So the
like
effectiveness of it isn't
isn't
as
as
good
effective
as it should
because it relies on light. It relies on the ability for the light to break through your skin, and if you have white skin, the light doesn't have as much of a barrier.
be. Yeah,
Melanin, it reflects light. So, like, and the commenter Michael Pan, he said that healthcare racism is a result of slavery, and that's exactly true. The myths that were perpetuated by slave owners about like black people being stronger or like having denser bones or having a higher pain tolerance, all of that is a direct result of slavery, and we never in healthcare we've never dealt with that. Like
yeah,
straight up until less than 5 years ago, like you were saying, black patients were less likely to get dialysis, which is like your kidneys have nothing to do with the color of your skin. Your nerves, your pain tolerance has nothing to do with the color of your skin. Like, I'm sorry, if I were to stab you and stab me, we would feel the same pain, you know? Like, and we should get the same level of healthcare, but that's not the case. And these biases, and doctors aren't like expected to like unlearn this stuff that they learn in school, which is why they're continuing to perpetuate it and why they're continuing to tell people like me that I have to expose my black patients to more radiation. You know, that is like that's just how it's just that's how it's created, and it is specifically created to get these people from the ability like get these people to not have the ability to get healthcare, and like they see it's a surplus population that they don't care about. Disabled people and people of color are more likely to be homeless. That's just a fact. And we see that if we're doing mutual aid, we see that. Like, and it is disgusting, and it is sickening the way that these doctors talk about their patients of color. It is so sickening the way they talk about it. Like, I just, and like I said, I've had black doctors who continue to perpetuate these myths without even like thinking about it. Like they've been indoctrinated to be like traitors to their class and traitors to their race and like perpetuate these myths, and it's
yeah,
so gross. Like I've straight up had doctors tell me that they don't even want to go they don't oh my god, I've had doctors tell me that, like, they don't want to go to Paris anymore because, like, there's too many Muslims and black people there, or that, and there are all these, like, rich, petty bourgeois people that, like, have no material understanding, and they're so divorced from the material reality that we live in, that most people live in, that, like, they just continue to say these, like, stupid bullshit things. And I've had doctors that blame disabled patients for difficulty with care, with like oral care. And it's hard. If you have joint pain in your hands and your fingers, you're gonna have difficulty brushing your teeth.
yeah,
And you're gonna have more healthcare costs. And yet doctors will blame the patient saying they're not trying hard enough. Which what do you mean you're not trying hard enough? Nobody's skipping brushing their teeth on purpose once they know the reasoning. I'll be honest here. I have mental health issues and I've had trouble brushing my teeth in the past. I'm missing 4 of my teeth. I have multiple cavities, multiple fillings, multiple crowns. And I work in dentistry and I know the importance. And to this day, sometimes I miss brushing. And yet, if I were a patient that didn't have dental experience, the doctor would blame me for it. They would say that I was just lazy, that I wasn't trying hard enough. When in reality, sometimes I'm just depressed and I have trouble brushing my teeth because I'm too depressed to get out of bed or I'm too sad to do stuff. It is, and the blame on the individual is ruinous towards healthcare outcomes. If we blame individuals for what are systemic issues, you're never going to get to the bottom of it. You're never going to actually understand or realize what is really going on. Like the fact that I keep getting told that Black patients just so happen to have more periodontal disease when that's bullshit. That's bullshit. I'm sorry, but like that's not the case. Black patients are just more likely to be poor and more likely to have poor health outcomes because they don't have access to healthcare.
Yeah.
It's a very obvious connection to me, and yet these people, like, I'm reading old textbooks and it says stuff like this. Like the textbooks say this stuff. Like I read old textbooks for fun because I love dentistry and I love teeth and I love learning about this stuff, and it's perpetuating these racist lies. And nobody's doing anything about it. Nobody's actually fixing it. And the only way that you can fix it is by having universal healthcare, by not having by not having these systems where they are specifically made to deny care for people. It's just it's the propaganda is crazy when what's told to providers. Like and then they push it upon to their staff too. Like it just ugh, it's so upsetting. Like I've been fighting for it for the last 3 years and nobody listens to me. And I'm essentially like called crazy sometimes for this, for like actually fighting for equity for my patients, for I used to switch out when I worked for the doctor that would use expired materials on medicated patients. I would switch it out without him seeing. I'd be like, oh yeah, that is the expired bottle. Yeah, because like I've read studies where like using expired bond means that the filling's more likely to fall out. And if you're using crappier materials, they're going to have horrible outcomes. And it's a self-perpetuating issue. you know um do I have contact? I do. I mean, I have a Twitter. I also have an Instagram, and then you can also contact me through the email from People's Revolutionary League. um that's
So
all at the top
yeah, that
of
was actually
our website.
that was one of the final questions that I was going to ask you. Was where can they find you and what do you have coming up
Well, I
next?
have a Twitter. It's kind of a silly name. It's FEEFLE Knight, KNIGHT. That's my Twitter. Um, I don't think you actually follow me back, Jay.
I I would have to
I know
I
you
would
have
have to
so many
spell it again.
followers. I have nothing against that, but I just find it really funny. But yeah, no, I talk about this stuff a lot, and I'm fighting for it within the healthcare system. But I think we all have to come together and like demand reparations, demand care, and demand a complete overhaul of how we're teaching our providers. We can't be perpetuating these racist lies into our providers because that is it's not it's not true, it's not helpful, it's not effective, and all it does is hurt people. It hurts people, it kills people. And as a healthcare provider, if you're working in healthcare, you should not be perpetuating things that kill people. That like you should care about your patients. And oftentimes these people are just in it for the money, you know. Um do I support cash payment reparations? I mean, yeah, I I think reparations should be done. I don't have like specifics like numbers or anything, but yeah, I do support that. Um like I think a redistribution of wealth in general is the most important thing. So I think that would be part of the redistribution of wealth. Um,
Yeah, that's a conversation that we have many times
yeah,
here. It's really reparations, especially cash reparations, is really just a class issue. Basically, the surplus labor was stolen from people like my ancestors here in the United States, and so they would never be paid back. And so, because they're
yes,
passed away, that money would go to the next of kin, being like myself. And other people who are also
Built.
freedmen, basically people who are Black Americans that are descendants of the chattel slavery. So
Yeah.
that's basically what he's asking about. But
Okay, yeah, yeah, sorry, I didn't understand what the question was, but yeah, no, 100%. I mean, labor was stolen from people and they should be paid for their labor. That's like a basic Marxian economics idea that people should be paid for the labor that they do, you know,
yeah,
and their labor was stolen through slavery, and so thus they should absolutely like be paid
yeah.
for it, like the next of kin, because that would have been, you know.
Thank you so very much for watching my channel, and I deeply appreciate it from the top and bottom of my heart. If you wish to support the channel further, so I can keep bringing you content that is educational and informative, you can become a patron on patreon.com/Jaybefaunt. You can find that link in the pinned comment or in the description below. No matter what you give, you'll be supporting independent media and education that helps make the world better. Thank you so much, and you can watch more of my content here. Mwah. Forehead kisses, and have a beautiful day.